and they might even extend it into Sunday's program as well. That might well be the way this thing goes before we are indeed done. A lot of good requests and ideas have come in there. Some of them, by the way, might be covered over the course of this program today. Dr. Osterholm is indeed on the Whiting Clinic LASIK and Cataract, kind enough to join us on this Friday afternoon. Doctor, once again, thank you very much for the time.
Thank you very much.
Last time we had you on, I believe, was about 2 weeks ago, if I'm not mistaken, and in that range. And so I'm curious, how would you describe the place we are in now, and is it in any meaningful way fundamentally different than what you felt about our condition then?
It unfortunately, the disease is marching on just as you and I talked about last time. And what's happening in these hotspots in the United States is only getting worse. And I think New York will, for the next several weeks, just continue to deteriorate in terms of what's happening there. We're seeing hotspots in places like Detroit, New Orleans, Seattle. And the other thing we're seeing is this transmission that's coming throughout the country, which without really pushing this social distancing, or I like to call it physical distancing, we're going to see case numbers increase dramatically in a number of places. I mean, even right here in Minnesota. And so, it's how we keep that down. So that's not a surprise. It's a challenge, and it's also a challenge to help people understand that this is just the beginning. This is the first inning of an 9-inning game, and that this could clearly last for many, many more months, where we'll have these ebb and flows of these big peaks of cases. And that's exactly what happened. I have to go all the way back to 1918, when that pandemic influenza strain, which this virus is acting just like, actually people don't realize that there were big waves in the spring of 1918, and then we saw it again late summer, fall of 18, but that we continued to have substantial activity through 1919 and 1920. And it wasn't until the vast majority of citizens had become infected, and in the sense either recovered and were immune or died. And with the immune the individuals, it was like putting a kind of a rod in the virus transmission reactor, slowed it down. The more people that recovered and were now protected. We're in the same boat. We're going to have the same thing happen to us. It's going to take a while for this to work through. So that leads me to my second point. You asked me if there's anything more disappointed. And, the federal response right now is a real challenge. That's coming from many different circles. It's not clear what we're doing. We don't have a national policy. We don't have a long-term plan. Numbers go from press conference to press conference. We've made all 50 states literally fight for, almost on an eBay-like basis, what available equipment is out there. We knew that we would not have nearly enough protective equipment devices for healthcare workers, the kind of N95 respirators we need. We knew we would not have nearly enough ventilators, but we've not had a national plan on how to deal with this. Every governor is pretty much on their own. And fortunately, there have been many outstanding governors responding to this. But that's the real challenge, I would say, right now.
Doctor, you have expressed that concern before. Some accept it. Some, as you know, think it becomes political. Let's leave that aside for a moment. I know you have had conversations. You're in the mix talking with the White House. What have you expressed that concern before? And if you have, what kind of feedback have you received or reaction to it? I mean, how would you describe your interaction at the federal level, whether it's the White House or elsewhere with the feds?
Well, let me just say, and, this will probably fall on ears that don't really care, and God knows I'll just get a number of additional hate mail messages, but, I've served roles in the last 5 presidential administrations, including this one. For a year, I was a science envoy for the State Department while here at the University of Minnesota, and traveled around the world on behalf of this government. I have served 2 Republican governors, 2 Democratic governors, 1 independent governor here in Minnesota. And at no time would anyone have ever known my partisan politics. I'm a private in the public health army, and that's my job. I've spent my better part of my career trying to actually develop things like the Strategic National Stockpile. It's one of the things I worked on after 9/11, and I split my time between the University of Minnesota and serving as advisor to then Secretary Tommy Thompson. So, I've always looked at myself as just anyone else with here in the military. You follow the general's orders. I think it's very important that the observations that people such as myself have right now, because we're not partisan. I want this president to succeed more than I can tell you, because my daughter, who happens to be a neonatologist, is on the front line every day. Her life is in someone's hands right now that I want this administration to succeed. So please take the comments that we're in disarray, that we don't have a plan, that we have done things like outsourced the distribution of what supplies we do have to a private company that has no special experience in crisis management, when in fact we have a FEMA organization that is actually very capable of doing it. We've not had the CDC at the table for over 2 months. CDC, the Centers for Disease Control and Prevention, has some very unique experience in pandemic preparedness and response. They understand how to determine what is likely to happen in terms of models and so forth. And so, I could go through the laundry list, and this is not partisan. I've talked to as many former Republican governors as I have Democratic governors, and they're all expressing the same thing. This is a matter of national and international crisis response, and we just aren't getting it. And, I think it's time more people spoke up. I have personally been warned, keep your head down or you'll get shot. We need straight talk right now. This is too important for all of us. Just this week alone, I've lost 3 colleagues who died from this infection, who we're all very close to. This is not just professional, this is personal to me. And so I want success, and I will do whatever it takes to help make that happen. We're trying to craft a national response plan right now, but trying to thread this rope through that needle has been hard, and it only makes it harder when they're not listening at the White House about what's happening.
I would assume you would agree then with the comment from General Stanley McChrystal. We should not be fighting COVID-19 as 50 separate fights, 50 separate states and territories, and certainly not at individual municipal levels. This needs to be a collaborative national level fight.
Absolutely, and you just heard from the person who is the head of the response to Katrina, General Mulray, who basically said the same thing this morning. We're all in this together, and what we need to do is respond accordingly. And first of all, we have to stop the happy talk. This is a disease that is going to extract a lot of pain and suffering in us, okay? But we can't lock down our country for 18 or 20 months. That's not going to be the answer in terms of the essential services, the economy. And again, economy is not to be equated with dollars and cents versus someone's life. These are not just numbers. These are real people who are our loved ones that are dying. But at the same time, we can't do that. We can't just turn all these cases loose. And right now, we don't have a plan beyond a couple of weeks. And this is going to go on for potentially months and months and months. And so we need that plan to understand how we don't flood our healthcare system, how we don't protect those who are at highest risk of having serious outcomes. And that's why I talk about threading the rope through the needle. We got to go in that middle spot where we release enough of society that the younger population who is going to have the least serious outcomes really are brought back into everyday life, and that we're able to do that. We do what we can in protecting those who are most likely to have serious outcomes, those who are older, etc., and that we get through this next 18 to 20 months till hopefully we can have a vaccine. Neither of the other 2 options I shared with you, I think, are acceptable, but we don't have a plan to do that, and we need one, and we're trying. Many of us are trying, but it is really fallen in deaf ears.
Dr. Micheal Osterholm is our guest in the fan. Last Thursday, Governor Cuomo said this. I want to get your reaction to it because it speaks to this balancing act, I think, that you're addressing. If you rethought that, talking about, he basically said that his stay-at-home order for the entirety of New York State was, quote, probably not the best public health strategy. If you rethought that or had time to analyze that public health strategy, I don't know that you would say quarantine everyone. I don't even know that was the best public health policy. Young people then quarantined with older people was probably not the best public health strategy, because the younger people could have been exposing older people to an infection. He seemed to be thinking out loud after the fact. Is there merit to what he said, or is that going too far the other way? What do you make of that?
Well, I think, again, when we're looking like here, just take Minnesota. This is us, okay?
Mm-hmm.
I don't have the exact number of counties that this virus has been found in, but it's in many of the counties. It's in every region of the state right now. And so I think from that standpoint, any one of these areas could become a hot spot tomorrow. I mean, when you think about, rural Minnesota, I love Minnesota. As state epidemiologist, I was in all 87 county courthouses in my career. I know this state well. And when I look at what goes on in a community today, the community hospital and the long-term care facilities in these locations, along with the schools, are the very bedrock of these communities. And when we get this virus into one long-term care facility, it goes like a wildfire. And that then will result in transmission in the community, because before you can recognize what's going on, it spreads into the family members who've come in to see the residents of the long-term care. Then it ends up in the hospital because these people get moved there, and that becomes a challenge. Pretty soon you can shut down the healthcare system of that community. And if that's not a substantial impact on that community, I don't know what is. And so, no one's exaggerating this risk right now in terms of what this means. We're not New York. We will hopefully never be New York, but we will see a substantial increase in cases here. We will see all the counties, not just a few, be involved. And so I think that that's what's really important to tell people, is it may not have hit here yet, but think of it this way. If you think anyone's exaggerating, tell me how many counties in this country are able to not be affected by seasonal flu. How many of them are able to shelter themselves from that? Every year, we see it right through the country. Hospitals, workplaces, schools, that all are impacted by seasonal flu. This is going to be the same way. This virus is going to find, each county, each town, each village out there. Fortunately, it's going to take a much, much lesser pain upon young children. But for those who are older, those who have underlying risk factors, I know people don't want to hear this, but one of the main risk factors right now is obesity. And we've got upwards of 45% of our population in the state who are obese. Right now there are a number of people whose lives are hanging by a thread in New York because their risk factor was they were obese. So I think that this is the kind of thing that we have to understand, that this is not somehow just trying to scare people, whatever. And, when we run out of resources, right now New York is literally within days of running out of ventilators. When you run out of a ventilator, which will happen throughout the country, that is almost in itself a death sentence, because now whoever's on the ventilator has a chance of making it.
Right.
Those who don't won't.
To the
That's
issue,
the kind of decisions we're going to be up against.
that I get, and the question wasn't to minimize the threat. The question was even to speak to your point about, how do we calculate such a thing as smart? I mean, you've said we can't shut down to the degree we had for 18 months. So how do we define whatever that so-called middle ground is? Is there a place for it that includes the idea of kids going back to school, or do you still view the risks inherent of that still outweigh what you're talking about trying to find a balance where you open up part of the economy?
That's exactly, you said it very well in terms of almost articulating my position. I wrote in an op-ed piece in the New York Times last weekend that what we need right now is an intellectual Manhattan Project. We need to bring the best minds in public health, medicine, political world, local, state, national, and bipartisan. We need to bring together the business community. We need to bring together medical ethics, etc., and sit down and say, you're not getting out of this room until you come up with a plan that takes all the points that you just raised into consideration and says, what do we really know about this? Does this make a difference or not? How can that be applied? If we lighten up the brakes here, what will happen? Right. I mean, a good example is just what's happened in Asia. We've had, everyone has said to me over and over again, well, look at Asia seems to have controlled it. Well, look what's happened this last week. China is now shut down its movie theaters. Basically, they have seen a substantial increase in the number of local cases. As they're releasing their population back to work, it's exactly what we said would happen. Singapore today actually declared a total lockdown.
Yes.
Because they've had uncontrolled transmission now after they were held out as the model that everything would work. We're seeing the same thing in Korea. We're seeing the same thing in Hong Kong. So I think that what that lesson is telling us is that this virus will be here. If we don't lock it down, we're going to have transmission. I don't think we can lock it down. At the same time, I refuse to accept widespread, uncontrolled transmission. Our job is to be smart. But that starts with straight talk to the public about what's going on. What are the challenges? And I have to say, Dan, I hear this over and over again from the media that, oh my, if you tell people this, they'll panic. I have not seen any panic anywhere in this country. Nobody has overturned cars, rioted, burnt down buildings. I've not even heard of anybody who has pulled knives or guns at a local department store when the last roll of toilet paper got taken off the shelf right in front of me. But I hear people who are scared, and they should be scared. But what we need to do then is provide them the leadership that says, this is what we're going to do. This is how we're going to do it. This is exactly what we know and what we don't know. And no happy talk, no major, we're all going to die. Most of us are going to get through this unscathed in terms of our own physical health. We've got to have that kind of discussion, and we are not. And that's the kind of leadership that I think that if we have that right now, we would do so much better in every regard trying to get through this. This is not a partisan issue. This is not a religious issue. This is not a rural versus urban issue. Blue and red will give way to black. Trust me. If this virus does what it's going to do and we don't do more to stop it, it won't matter if you're blue or red. It will matter if you're black.
Let me ask you
That's the problem.
Let me ask you a question of practicality. I think yesterday, Mary Krinke, the Minnesota Hospital Association's government relations director, told state lawmakers that hospitals here are losing $31 million a day. And this goes back to, if you recall, last month the governor had ordered healthcare providers to stop all elective surgeries. Those are huge revenue generators for hospitals. Krinke acknowledged that the hospitals urged the governor to take the step, despite the loss of revenue, for the obvious reason, because the idea was we want to have our supplies, we didn't want our personal protective equipment to run low. But now she's saying we're in desperate need of cash to keep some of our hospitals open. To the question, the practical question that a lot of hospitals are asking about, it sounds crass, but we are bleeding money. We need the money as well. Was there a better way to do it regarding when we started pulling the plug on elective surgeries, or was that inevitably something we just had to do and take the hits as a result?
I think it was exactly the right call at the right time because, again, you want to stop this before you get to New York. One of the problems with prevention and public health, if nothing ever happens, people will say, well, look at nothing happened.
Yeah, right.
Why should we have supported you? On the other hand, if we wait until it happens, then it's too late.
Mm-hmm.
And so, this is the art of public health. It's kind of, I liken it to surfing the big waves at Maui. If you're in front of that wave or you're behind that wave, it's not a good moment. But if you're on top of that wave, that's what you need. Our job is to run the wave so that we don't do anything to adversely impact the population. But when it's needed, you do it. You put the pedal to the metal. We have data here in Minnesota showing in the last 2.5 to 3 weeks the increase in influenza-like illness in our communities, which is a system we have in place to look at flu during the regular flu year. Well, right now, that's not flu. That's COVID-19, and that's picking up statewide. So, I can tell you that everyone would have second-guessed any of the leaders of the state had we not done this kind of action and then suddenly started having a bigger problem than we have now. We've got this virus, and I don't know what the exact number is today, but just earlier this week, we already had it in 38 different long-term care facilities in the state. That's not isolated. So I think that, in a sense, to get ready, I hear the Hospital Association, and they are right on the mark, and we need to support them. I come from a rural Iowa farm town where the local hospital is absolutely critical to that town. I get it. So I just want to reinforce that everybody's right here. It's a challenge for the hospitals, but it was the right thing to do at the right time. Now we've got to do is figure out how do we let up on that, when we let up on it, and when do we put the pedal down to the metal again? So that if we get the next wave, we stop it from doing what it's doing. And this is the art and the science of public health all interweaved into one.
I want to finish up with the little talk about the analytics, about the predictions of the waves, the peaking, how much, how many casualties, etc. As you know, there are, for the state of Minnesota or even nationwide, many different models, and they don't all come to the same conclusions. Some of them come to dramatically different conclusions. Some are pretty close, actually. So to the average individual listener here who's out here trying and is not doubting the issue that it's legit, is trying to get a handle on it and say, I'm having a hard time knowing which model to believe, what goes into those models. How would you guide those individuals to try to figure all this stuff out?
Well, first of all, somebody who has 60-some hours of graduate statistics, let me tell you, my conclusion on models is they're all wrong, and some just give you useful information. So let me just back up and just share with you again how this topic can be so misunderstood. The model that the White House is currently using, which came from the University of Washington, was a model that looked at a total shutdown that started this week, just like Wuhan. Okay, everything down. I mean, what we have right now isn't even close.
Right.
And it's in all 50 states. And it goes into effect, and it stays in effect for the next 4 months. And at the end of 4 months, that's the number of cases. They said 80,000 plus cases. Okay? That's not realistic any more than the man on the moon. That's not going to happen. On the other hand, you have these other models that look at the entirety of the next 12 to 18 months. They come up with the 1 to 2 million number. I've decided, forget all that black box stuff because, anybody can argue about what's inside the black box influences it. And if you have certain political beliefs, you may think that we're trying to overhype the situation or you're not telling them it's as bad as it really is. I'm just going to use common, what I call greater Minnesota sense. Just let's take these numbers. 320 million people in the United States. Assume 50% get infected with. If you look at any of the previous pandemics we've had, or if you look at any of the reasonable numbers we're talking about, everybody in my business would say 50%, that's probably low. Okay, 50% of 320 million is 160 million. Of that 160 million that gets infected over the next 12 to 14, 15 months, okay? 80%, based on everything we have right now, would tell you it's going to be mild to moderate illness. They won't even seek medical care. It's kind of like a bad flu at most. The other 20% are going to be more severely ill. They will seek medical care. Probably a good 10% will see a physician but never be hospitalized. 10% will be hospitalized. And of those, about 5% so far will require intensive care. That's 5% of the total. 1% will die. That's what we've seen over and over again. Well, that 1% of deaths of 160 million is 1.6 million deaths. The number requiring intensive care is, in that 5%, 9 million. Now, I'm telling you, that's not, that you can change the numbers if you want. You tell me what you want the percent to be of this or this. That's just not black box. That's the reality. If 1.6 million people die over the next 12 to 18 months in this country, that will be absolutely devastating. If you try to think about what this will do to our hospitals, over 9 million people requiring intensive care medicine over the next 12 to 18 months, that will be devastating. So I think, Dan, to take all these models, throw them out the window. Just use common sense. And that's the numbers I just gave you that everybody can see. They're all transparent.
And still quite stunning. I mean, they're going to get people's attention. I mean, how much can a levels of, how do you factor in levels of mitigation? For example, here, as you say, some places are not even close to really shutting down to the degree we have. Some people think we need to shut down even more. How do you then factor in the sort of mitigation moves that are probably being made way too piecemeal, but that are nevertheless, taking place in various parts of the country?
Well, the numbers I just gave you is with me factoring in mitigation. If we don't do mitigation, we actually hit what I call the death cliff. Whereas once you actually run out of ventilators, no longer is the case fatality rate of 1%. You're talking 10, 15, 20% more, because you don't even have the care. And then on top of it, we're not including here, and this is what everybody's missing, is the collateral damage is going to be devastating, because we're still going to have heart attacks, we're still going to have strokes, we're still going to have automobile accidents, we're still going to have acute asthmatic attacks. We're going to have all these different things happening in the healthcare system that is virtually in chaos because of this. And so think of all those things that are going to happen. And we have to weigh that in too, because this is the healthcare system that can't handle the COVID-19, that now has been basically disabled to handle anything. And so the number of people that could die who won't have COVID-19 infection but are dying because they shouldn't have died if we had our adequate medical care are. And so this is where people just don't understand this, okay? I just to give you a sense of this, 30 days ago, COVID-19 in this country was so far down the list of causes of death it didn't even make your top 30. That was just 30 days ago, okay? Today, it is the number 3 cause of death in this country, and it will surpass 1 and 2 by the end of the weekend. Now, think about that. COVID-19 by Sunday will be the number 1 cause of death in this country. Now, you can tell me, that's not happening here, don't worry about it. And it's just getting started. It is just getting started. And that's what people don't think, hear, or feel. That's why this is urgent. This is why we need to plan. This is why what we're doing right now may seem inconvenient. For the people who are unemployed, for the people who are frightened about where they're going to get a next meal, that they're going to be able to pay their rent, these are real. These are legitimate. To the healthcare workers who have just watched their 14th patient die in the last 3 weeks, this is incredibly tough, particularly when one of those patients happens to be one of your colleagues who stood bedside with you just 2 weeks ago helping care for somebody who then picked up the infection working there and then now is dead. So, we can't minimize this pain. This is incredible. And we can't just come back to numbers, because these are real people. These are our loved ones.
It goes a lot beyond the stock market, absolutely, whether the stock market's going up or down. Last item for you. Are there any of the there's a lot of research, a lot of studies being jump-started all over the place. Is there anything that encourages you among the studies that you're aware are being done? I know there's no certainty in this thing, and it takes time, and we can't fast forward it too much. But does anything encourage you in that regard?
Nothing that encourages me as a given drug. What encourages me immensely is the incredible response that's occurred. The NIH has done an amazing job. Organizations like my own university and the groups that study in the chloroquine here to look at how well it works. Those studies were set up in record time. They are well designed. They're going to give us the answers we need. And they're looking at a variety of different drugs. Now, how can that impact it? That would be one of the most wonderful things. The problem is, again, by the time that these studies are able to show us the information, the drugs get licensed even on the fastest pace possible, and then to be able to gear up in the pharmaceutical industry to make these drugs, distribute these drugs. Please don't forget that there are basically 8+ billion people in the world that all want these drugs, not just the 360 million of Americans. And so one of the things that's going to have to happen is what's the equity that is positioned in all of this for the rest of the world. We may not be able to get a lot of these drugs right away as much as we want, because everybody else is going to want them too. And that's going to be a huge challenge. And again, we really haven't thought through that one. How are we going to do that?
Last item, Dr. Osterholm. You're not a magic wand guy, you're a science guy. But if you were allowed to have a magic wand and could change one thing about our approach beyond, I think, your urgent plea for this to be a national in scope, is there something? Is it, you say here, would it literally be everybody for at least a period of time in the country, no matter the state, has to go to the stay at home sort of edict, or is it something else?
I wrote about this in the book I published 2017, Deadliest Enemies, where I laid out a scenario just like, unfortunately, what's unfolding right now, and saying it would happen. And one of the things that I urged in there is that rather than make this be a U.S. versus a China or versus a Russia or any other country, rather than make this a red versus a blue state issue, rather than make this about race, ethnicity, income, all the different things we could. This should be about us versus a virus, just as if the Martians were attacking us. Wouldn't we all want to, as a world, come together for one time and just say, this is us versus them? And there's so much more we can do working together here and not blaming and not doing that and say, well, what do you mean I'm blaming? I'm just talking about getting a plan. But if we could come together, that would make all the difference in the world to getting people through this. You've heard me say this before, Dan. You know, one of the things people want is they want leadership. They want straight talk. They want somebody to tell them the truth and tell them all the bad stuff, but what we're going to do about it, what we're trying to do about it, and then move forward. If I could have one wish, we have FDR back along the fireside chats, and we would have somebody who would tell us how we're going to get through this and why we're going to get through this and that we are going to get through this. And right now, we don't have that.
Thanks again for the extended time, Doctor. We'll be in touch as always.
Thank you very much.
Thank you.
Dan.
Thank
Bye.
you. Micheal Osterholm with some pretty grim stuff. I'm not going to deny. I don't think there's any way to sugarcoat it or to put any pretty varnish on it. We're a little behind schedule. We'll get a short break in. We are going